Okay, Jonathan, you may begin, please. Introduce our guest.
Okay, guys, welcome to the session on COVID-19 resources for farm workers. We're asking you to show respect by muting your mics. When not speaking, please use the chat box to put in your name and region as well as any questions you may have, and we'll monitor that. We would like everyone to know that this session is being recorded. So please turn off your video if you don't want to be shown on camera. And now, without further ado, I'd like to introduce Jorge Martinez and Monica Juarez from the Oregon Health Authority. Welcome.
Thank you, Jonathan. It's a pleasure to be here, and welcome everyone that's joining us today. Thank you to Luis for coordinating this and helping out. It's a pleasure to be here. So my name is Jorge Martinez. I'm with the Oregon Health Authority, the Community Partner Outreach Program at the Health Authority. And today we're going to be sharing some resources related to COVID-19. I'm here with my colleague, Monica. Monica, you want to introduce yourself?
Yes, good morning, everyone. Monica Juarez. I also work with the Oregon Health Authority, and here we'll be giving you information about COVID resources and information that are happening across the state in relate to migrant seasonal farm workers. And it's a pleasure to be here virtually. I wish we can be in person, but we're doing this virtually for all of you.
Thank you, Monica. Thanks again, Jonathan and Luis and everybody for having us today. It's a pleasure and an honor to be here with you all. Such important work that you all do. And we just want to make sure that we're providing, up-to-date information and resources to be able to help the community and the families that you work with with regard to COVID-19. So the agenda that we have today is I'll get into some of the overview and background of who we are and what we do and how we're helping the migrant seasonal farm worker community. And then Monica is going to get into some of the vaccine stuff and some of the resources. So that's what we have on our agenda for today. So a little bit about the Community Partner Outreach Program. The Community Partner Outreach Program, or CPOP, as it's commonly known, is part of the OHA External Relations Unit. So our manager is Oliver Rivera. Monica and myself work under Oliver Rivera. He's the manager, and he sits directly under the director's office at OHA. So that's kind of the structure of who we are. And so we are responsible for providing training and ongoing technical support to Oregon's community partners that do OHP application assistance. So we train them, we provide technical assistance, but more recently with the pandemic, we've been also involved with providing resources to the community with regard to COVID-19. So we have approximately about 300 community organizations that we partner with around the state, and that includes approximately 1,400 individual OHP assisters. Those are approximate figures, they're not exact figures. So I just want to say that, but we are a pretty large team. There's about 20 to 25 of us. I forget the last exact figure, but we are a big team. And we do have a presence throughout the state. These are the regions that you can see here throughout the state. And these are the regional outreach coordinators that work in each one of those regions. You can see some regions have up to 3, depending on the population size, et cetera. And then we have some statewide assignments as well. John McDade, actually, he works with the schools and the Migrant Ed program and other school-based and educational programs. So you might be hearing from him soon. But this is who we are. This is where Monica and I work and where we come from through this work. So, so shifting gears a little bit, and I appreciate your patience with all of this background information, but we think it's critical to share with everyone. So Monica and I are here to talk about the perspective of our COVID-19 response, the OHA's COVID-19 response for migrant seasonal farm workers. And part of that response includes the Protecting Oregon Farm Workers program, which began early on in the pandemic, specifically to address the needs of the migrant seasonal farm worker community. It is the state's official response to the migrant seasonal community. Jonathan was actually a part of informing that the process and how we developed and designed the objectives for that program. So that sits within the community partner outreach program. We started with a grant program, right? We reached out to community partner organizations and we said, hey, help us do outreach to the community, help us reach this population. And we started with the 16 original partners.
Her first name wasn't on the appointment, so.
And that turned into 22 partners that we have today, 22 partners, and they're located throughout the state of Oregon and all the key areas that we work in. But so their responsibilities are to serve the migrant seasonal farm worker community specifically, and that includes outreach and education, right? Educating the community about the effects of COVID-19, how to prevent it, how to stay safe, where to access resources, all that kind of different stuff. And then PPE distribution has been a big one as well. These partners also they've distributed, hundreds of thousands of individual pieces of PPE directly to the hands of migrant seasonal farm workers. And then they do COVID-19 wrap services. So, that could be related to housing, wage loss, whatever have you, anything related to COVID-19 as well. And then they also help with testing and vaccine registration and navigation. So let's say somebody wants help with registering for a testing event or doesn't know where to get vaccinated, they can go to these organizations and these organizations can help them get plugged into those services. Again, these partners are available to assist the migrant seasonal farm worker community, specifically access COVID-19 resources. And as they are also available to assist you as MEP staff in accessing and helping your community access those services away. So their services aren't just available directly to the community, but they are available also to organizations such as MEP. And so how do you contact those people? How do you reach, or where are they? Where are they located? I'm sorry, got ahead of myself a little bit there, but so these are the major regions where they're at. We have Southern Oregon, the Oregon coast. You can see them all. I won't go through all of them. You will have access to these slides and you'll be able to look through it all. But these are the organizations that work in those areas. And these organizations have a proven track record of working in this community, right? Maybe some of you already work with them to do OHP application assistance or COVID-19 work, whatever it may be, but all of these organizations are available to support you in helping communities get access to resources. So these are the areas, if you're located in these regions, these would be the organizations that you reach out to. And so here's their contact information. We also wanted to share their specific contact information, and I've shared this document with Luis so he can share it out to everybody that's here today at this presentation. You will have this information, and we have, it's the organization name, the region, contact, and then their contact information. So again, we encourage you all to reach out to these organizations. If you have a family that comes to you and says, where do I get vaccinated? Or where can I get PPE? Or my brother got his first dose in Mexico and now is looking to get his second dose in the US. Any multitude of questions that might come up about COVID-19 or OHP or CAWM or anything like that, these organizations are there to help you. So that's the POF program. And again, we have a lot of them. There's 22 of them around the state. just look at, whatever your region is or whatever county you work in and reach out to them. It's a good resource to have. This is some of the work that the POF partners have done around the state. We purchased 3,000 air purifier units for families, for farm worker families around the state, and our partners actually helped us distribute them. This picture, I believe, came from OCDC in either Klamath or Malheur County, but we distributed some of those air purifiers out to OCDC, and then they were able to give them to the families. And this was one of the distribution events. I believe we gave about 200 or 300 of those air purifier units. So this is the type of work that POF is doing, right? PPE distribution, not just masks, not just hand sanitizer, but also, things like air purifiers, water canteens during the hot summer months, all kinds of different activities that we're looking into. And we're going to continue to do this work through the end of, through about mid 2023. So hopefully we'll get more funding to continue this. But anyway, it's really, really great work that we're able to do for this community. And again, this was a partnership. This purifier unit project was a partnership with OCDC. OHDC helped us. And then we looked to other agencies in the state, Oregon Employment Department, and of course our POF partners. And so we just finished that project. So another thing that our partners actually do is stand up vaccine clinics. This picture you're seeing here is from a vaccine clinic that they did in June in Hermiston, Oregon. We worked with Uvalkyrie out there in the Hermiston area. And this was at a Guatemalan church there in the Hermiston area on Main Street. I think they vaccinated about 35 people for this event. And it was totally stood up by OHA in collaboration with Uvalkyrie and the church. It was kind of a collaboration, and vaccinated 35 people, majority of them migrant seasonal farm workers of Guatemalan descent in the Hermiston area. This figure of 20 is inaccurate. I apologize. There was more vaccinated than that. But anyway, so that's some of the work that our partners do. They do really great work. They distribute PPE. They work directly in the community. They are the boots on the ground for OHA. We could not do this MSFW response without them. We couldn't get the resources out to the community without them. We're going to shift gears again really quickly here and just talk about what is happening with COVID-19 around the state. And these numbers are as of earlier this week, the numbers that you see up here. The total cases that we have in the state of Oregon are 367,000, thereabouts, over 367,000. And we have about 20,000 people that have been hospitalized. You can see those figures there, right? There's a lot of unknowns, but so this is called the Ppe curve, and essentially just demonstrates cases, as they've gone through Oregon. You can see it's gone up and down during the pandemic, and we peaked, right around August, September. It peaked, and it's finally starting to come down. And the projections are is that we're on that downward trend, and it's going to continue that way. But we're not sure. I mean, anything could happen. I don't want to give false promises or say anything I shouldn't, but it is on a downward trend right now. And so, but we're not out of the woods. We are optimistic. We're going to start vaccinating kids. The vaccine is readily available to anyone pretty much in Oregon. But that's what's happening. That's what's happening. The pandemic is still very much alive in Oregon. But we are seeing a downward trend in the cases as compared to, a couple of months ago. So that's the case count. These are hospitalizations. You can see, total hospitalized folks up here. These are ICU beds. I'll let you guys look at this. I won't go into it in too much detail. You can look at it on your own time, but you can also see that this stuff kind of pretty much matches the Ppe curve that we were seeing up here. So as the cases went up, excuse me, so did hospitalizations. And now we're on a downward trend with hospitalizations and ICU bed visits and all that stuff. So we are on that downward trend, but we're not out of the woods yet. Okay, shifting gears one more time really quickly. So the impact, so COVID-19 has had an adverse, disproportionate impact on the Latino community of Oregon, on all people of color, and very hard, specifically on the Latino community, and by proxy, by default, the migrant seasonal farm worker community. So as you can see, out of the total cases that we have in Oregon earlier this week, the 367,000 cases that we had, 50% of them were not non-Latino, and 17% of them were Latinos. And if you think about that, the Latino population of Oregon is about at 12%, depending on where you look, 12 to 15%. So this number, the 17%, very much exceeds the number of Latinos, what should be attributed to this population, to our population. So it's a disproportionate impact. All of this to say that we are being disproportionately impacted. And this is common knowledge, right? I mean, we know this. We know that the community, the Latino community, and the migrant seasonal farm worker community is being disproportionately impacted. So approximately 11% of Latinos have tested positive for COVID-19. By comparison, only 8% of non-Latinos have tested positive for COVID-19. So again, this is to demonstrate that disproportional impact, 11% as opposed to the white folks, only 8%. And so this is a really staggering figure right here. So in the Latino community, for every 100,000 people in the community, you have over 11,000 people that have received COVID. And for the white community, their non-Latino community, you have 4,929. And this is data that was taken from OHA's dashboards, which are really great. You can look at them yourself and look at all the data related to what's going on with COVID-19. So again, I want to emphasize our community, your community, my community as a Latino myself is being disproportionately impacted by this disease. And we are trying our best at OHA to reverse this trend, to address it, to provide resources to the community, to collaborate with people like you all, to figure out how to get more people vaccinated, how to educate more people, how to reach them in general. So, so at this point, I'm done with my portion of the presentation. I want to turn it over to my wonderful colleague, Monica, which is going to talk more specifically about vaccines and other additional resources. Moni, sorry for the long talk there.
Oh, no, you're great, Jorge. Thank you so much. So as you can see, Jorge just shared, right, there is those partners who are out and supporting our community that have been impacted. Many of you have also witnessed that with your own families and seen it across the schools. So again, the vaccine is very available, and and it's free, and it's regardless of immigration status. I know many of you have already been vaccinated, but there is a lot of our community who still hasn't, and so we wanted to share, the Oregon Health Plan also, covers it. People who have COWAM, which means the emergency medical only, also covers the portion of the vaccine, and this is it's available in many medical clinics. So it's something that we need to always encourage our families to get access to a vaccine, and it's available in multiple locations. So I just wanted to kind of emphasize that the vaccine is the one hope that it will get us out of the, out of the loop of the up and down graphs that that Jorge was showing. So we go to the next, Jorge. Okay. There. So you can see here a little a little more of statistics of what Jorge was sharing, is that Latino community in Oregon really has, you know, and when you see the vaccination rates, as I was mentioning, when you see or percentage of the population, one dose, or the white population has 71% vaccinated, and then you look at the Latinos, it's 55.9, so around 56%. And this is one dose. And then when you look at the whole series, which is the 2 vaccines, you can see we're at even 50%. And then right now, which I will tell you in a little bit, the extra dose, which is also available for people, it's, you know, barely 2%. So as you can see, we were highly impacted by COVID, and still the rates of vaccines are pretty much very low. Okay, and you've probably seen this if you are connected with our social media, if you're connected and familiar with, for those of you who receive updates from OHA, this is one of the flyers that was developed to just kind of explain, you know, who qualifies for that 3rd dose, or who qualifies right now for the booster. And just to make it easier for you, for those who have immunocompromised, severe, you know, let's say they're under country treatment, they have any urgent medical needs, they do qualify for the 3rd dose 20 days after they receive their 2 shots. And right now, the booster, which is most of us will qualify for, is available. Before it used to be just 65 and those who have immunocompromised, but as of right now, it's available to everyone who works in segregated places like work in farms, work in food processing places, work in grocery stores, like teachers, anyone who works with, and essentially with the public, is qualifies for the booster. So please, if you haven't scheduled your appointment, please take your booster. It's actually been shown that after 6 months, you need that reinforced, because as you can see, there's people who have told me, and I'm sure you have heard, it says, well, the vaccine must not be that good because I got my vaccine 6 months ago and now I'm sick. So that means you're due for a booster. So please make sure that you tell your families about that, and also you schedule your appointment. Next. And so now let's talk about the pediatric vaccine. It's a topic that is being you know, as there's a high interest, especially as many of you that work with families and kids, students who need the information. So the CDC and the Scientific Safety and Review Group approved the vaccine for kids and 5 to 11 years old. And as of right now, it was so Oregon's strategy is to make sure that the vaccine is available and is easy access at different locations. So many sites right now are receiving the vaccines, and clinics, hospitals. It's just being basically shipped everywhere in the state, waiting to start providing those vaccines. You go next, Jorge. And oh, thank you. And so accessibility. So like I said, the federal qualified health centers and pediatric clinics now have them, pharmacies, public clinic, and actually as of Monday, that's when they started shipping. So they should have them by now. And so the new strategy is that they will be adopted into also schools, drive sites, and also large volumes. You've probably seen a lot of community events that are happening, so it'll be pretty similar to what you've seen. And I think our strongest partnership is going to be within schools. Okay, go ahead. And here's like just a basic list of where the vaccines have been distributed. Like I say, starting on November 1st all the way to the 9th. So all this week and next week, that's when the amount of vaccines will be distributed. As you can see, I know all these, FQHC is qualified, federal qualified health centers, which is many of the county health departments. Also, OHA, or vaccine unit, pharmacies. And so, yeah, it's pretty much gonna be distributed in multiple locations.
Monica, there's a question in the chat. What's the difference between the third shot and the booster? Are those the same thing? Third dose and booster?
Yeah, so the third dose, that's for people who have, like I mentioned, immunocompromised. Let's say they have under treatment or something that their immune system is needed the third dose, and that's they qualify for it like basically 28 days after their two vaccines. And the booster, that's 6 months. So that means after you take let's say you don't have any immunocompromised chronic disease or anything like that, then you can wait your 6 months and you should be able to take. So that's like the difference. So basically somebody who has immunocompromised will need that third dose. And many of us will probably just have the booster.
And are the shots the same, or the third dose is really like a strong one and the booster is just a?
It's the same. It's the same
Oh,
dose.
it's the same. Okay.
Yeah.
Thank you.
It's just some people will need a reinforcement. All right. So now if we go back to Jorge, that's a good question. And like I said, we have these flyers available in our OHA. And also we put it on OHA in Espanol if you would rather have it in Spanish. Okay, so here's some of the information. Just let me close that. Just a second. Give me 1 second. Just shutting the door. I know some of us are working from home. Okay, so just wanted to say, so there has been some research done that, at least 1/3 of the parents will likely vaccinate their children. And then there's this one other third who would rather just wait and see. And so just wanted to, many of you who are parents are probably, have these questions. So some of the messaging that we're gonna be working at here at OHA is that, so vaccination for it's a parent decision, and we will share the stories, making sure that, it is a journey, ask questions to your provider, to pediatrics, see, and it's going to be similar to different of the vaccines, right? You always want to make sure that you share if there are any allergies, any of that, so that your provider, your child's pediatric also, it's available to answer any questions. So just make sure that that that's something that we're working with. And we're also going to have a lot of pay media, radio, and making sure people know that the vaccine will be now available pretty soon. And go next, Jorge. So now I'm going to talk a little more. This is in regards to, you've probably seen it on the news. You probably have heard about it. It's something called monoclonal antibody therapies. That's probably something new for so many of you, or have heard about it, or maybe the first time you hear about it. So this is a therapy that was approved for people who have, so there's two ways that people can get this treatment. It's basically a treatment for people with COVID. So this treatment or therapy is for 2 different groups. The first one is for people who have a positive COVID case with symptoms, or somebody who was exposed. And so that's kind of the treatment that is available. And if you go next, Jorge. The next slide. So who is eligible for this treatment? So any adult over the age of 12, children in this case too. 12 are children, adults, and so who weigh more than 88 pounds, and like I said, somebody who has a COVID positive case, or by a PCR, which is basically the test that they take, and who have seek treatment within the 10 days of having symptoms. And these are for people who are also outpatient, meaning that they're not receiving oxygen treatment. Somebody who's in the hospital, obviously they're using other types of treatment, but this is somebody who, let's say they have symptoms, they're at home, and they just, essentially this treatment is to avoiding going to the hospital and be taken care at home. So like I said, this treatment has been approved, and who qualifies is considered a high-risk patient, somebody who's 65 and older, has diabetes, obese, overweight. I mean, you can see the list. It's available. So it's pretty much what if somebody has COVID and needs a treatment, it's something that they can look into. And I will tell you more where to find it in the next slide. And here are the places where, so basically before it used to be only taken in the hospital where they give you into an IV, but now they just give you a shot. And there's like multiple places where they can get you the shot if you need to. So there are kind of some images. So go next, Jorge. So what is the cost? It is free and should be free for anyone, regardless of their insurance status. So the Oregon Health Plan covers it. Also, people who have COWAM, the emergency only benefit, would also cover it. Private insurance will also cover it. So if you have questions about it, that you can just click on it. And like I said, Jorge will be sharing this slide so you can have a copy of this information. So some additional information is that, so right now, before I jump into this topic, so just call your doctor, call your clinic, your health department, ask them about a therapy. And like I said, this is also for people who haven't taken, like, let's say they got only one vaccine, COVID vaccine, and they still need a second. And in the, in between they got infected, they can go and get that treatment. So this treatment does not replace the vaccine. This treatment is only to help you and feel better so that you avoid going to the hospital. So it has actually an 81% rate that people will feel better with that treatment. So just wanted to let you know that it's something that you have access to. And so now I will go back into the treatment, the vaccine, pediatric vaccine. We're gonna have a meeting on next week, actually, on November 10th. It's gonna be from 10 to 12:30, and it's gonna be via Zoom, and it's gonna be in Spanish, and it's for community partners. And we're gonna have Dr. Emilio Deves, our senior health advisor, who is gonna be providing information and answering questions, concerns, getting feedback for community partners who wanna learn and know more about the pediatric vaccine, if they have any questions. So I invite you to please join us, sign up, and we'll be there too. If you have families, community organizations that are interested, please join us with this webinar. In addition to, there's also gonna be, this is gonna be an event that's gonna be on Facebook Live, and it's gonna be again with Dr. Emilio and Dr. Ruzuñiga, and it's gonna be in Spanish, and this is in partnership with PECUN. They will be connecting with a community in regards to the vaccines for children 5 to 11. So stay tuned. That's gonna be on November 18th. And some additional resources, as I mentioned, all the pediatric vaccine will be available. It'll be totally free, no cost. And something that we're hoping, as Jorge mentioned earlier, is that if any of you that are, I know we have partners, all of you that work throughout the state, please let us know if at your location, at the school that you work with or partner, are interested in and hosting a vaccine event. We, Jorge and I, will support. We have vaccinators, we have the vaccines, we have many of the logistics we will take care of. I think it's just, we really want to make sure the vaccine is accessible to our families. So let us know if that's something that you're interested. We will hope to connect with you, and you have our contact information. Actually, this presentation has our contact information. You can always let us know. And like I said, we're our focus is that the vaccine and resources for our migrant community families available in schools, farms, housing, markets, stores, anywhere where our families gather. Okay, and let's see. Yes, so I just wanted to let you know also that effective November 8th, which is, in a few days, literally. So non-immigrant or non-citizen people who are going to be traveling will need to have proof of their vaccine, prior to boarding the plane. And that will be an exception for kids on teens under 18 who are, people who are medically unable to receive a vaccine. So those exceptions are still in place, but it's important to know that, people need to have their vaccines prior to traveling. Like many of our families who, tend to travel and during the holidays. So permanent residents and citizens who are not fully vaccinated must provide a negative, technically a negative COVID test. And thank you, Jorge. and so, like, again, or they have to provide to the proof of their vaccine, and that's 3 days. The proof of the test has to be 3 days prior to the departure. And you can also find more information on the travelstate.gov to hear the latest. But again, this is November 8th as the holidays approach. And go next. So I don't know if many of you have heard of this resource. It's called Empleo. Empleo is a non-government organizations that it's a partnership with the Mexican consulate to provide information about to immigrants about workplace rights. And this program started in 2004, so it's been a long time program, and you can find more information on the phone number there, the 1-877-552-9832. The next one. Oh, yeah. That's all we have for you. Here, there's our contact information or email address. Jorge, I don't know if there's anything else you want to mention that I might miss. I know you also have questions. Oh, I'm not sure if anyone has questions. I know we have a few more minutes. Jorge?
I don't have anything. I guess I would just say, if anybody has any questions, I mean, we have a little bit of time, so we can, if you want to throw them out now or however you want to do it. Here's our contact information. We are available. We're here to serve you. We're here to collaborate. So if there's anything that you found interesting, I guess I would really encourage everybody to, if we can go back in the slides here. I would encourage everybody
to get from this card this week.
Looks like we have a question, Jorge.
Maybe.
Not something that you want to quit, but there's something that you give up on.
Regarding the third dose, you had said that they recommended after 6 months of your second vaccine. Is this something to do every 6 months from now on, or just the third dose? And yeah.
Yeah, is that right now it just, like I said, this is a virus, right? That we as scientists are seeing the trends of the virus. We're learning more and more. Something that was learned, it was in, I think it was the first country in Israel. They vaccinated everyone 6 months after their first dose, and they noticed that really helped. Especially, like I said earlier, there's been cases where people got vaccinated and they got infected again, and they're wondering why, and so they realized that definitely our bodies, just like we get our flu vaccine every year, they realized that 6 months with COVID, they need the booster, technically. And so far we don't know, right? It's something that it may be, I not a doctor, disclaimer, not a doctor or scientist, but this is information that came from our health advisors at OHA, and also collaborating with the Centers for Disease Control on whether this is something that is going to be needed every year. We don't know, but as for right now, we encourage everyone to get their booster dose 6 months after their second shot. So thank you, Mimi. That was a great question.
Could you share what Cohen stands for and how that affects especially our migrant families that are undocumented?
Sorry, what was the term?
Cohen. What? C-O.
Oh, Cowen.
Yeah.
Yes, thank you.
Pronunciation.
Cowen. Yes, Cowen is a health insurance program that is available for immigrants who technically undocumented, who otherwise will qualify for the Oregon Helpline, but because of their immigration status, they will only receive the emergency. And I mean, it's I would say encourage families to apply, because we just never know, right? And especially because Cowen covers a lot of COVID related, like I said, the vaccine and the treatment that I just mentioned. And I mean, forbid anything that may happen in the emergency room, is just great to have it. And some of the hospitals, even if there's treatments let's say in the emergency room, there wasn't an emergency, but they went because to you is an emergency, so you go and seek healthcare. A lot of the hospitals do consider Cowen one of the status for them to provide discounts that the hospitals have, because they have charity programs, and a lot of times when they know the family or the person has Cowen, they do apply the charity program, which is basically help pay their costs through the hospital. So and that's a benefit level to the Oregon Helpline. So, and that's for technically anyone who is documented over the age of 19. And for many of you, you probably already know this, but if we have children and teens who don't have documentation, permanent residence or citizen, they do qualify for full OHP benefits under the age of 19. And this is regardless of the immigration status. So it's good to know that we have something to offer here in Oregon. And so, yeah, it's good to know.
Yeah, that's amazing that everybody's covered up to the age of what, 18, 19?
Yeah, up to the age of, technically throughout the age of 18.
Of 18.
And,
And so if you have students that, any of your students that have medical needs, they can all cover for, is it still called Cover All Oregon, or does it have a different name?
Cover All Kids, yes. Yeah,
Cover
it's a full comprehensive insurance, has dental, vision, transportation, interpretation. It's a full coverage, and so it does provide all those benefits. And the income, it's actually pretty high. Many of you are probably familiar with the FPA federal poverty level chart, and it's up to 300. So a family of 4, technically they can earn, I believe, $64,000, and still their kids will still qualify. I'm not have it in my, I don't know, Jorge, if you have the income chart, but something that I'm always good to remind people where yeah, so I know many of our families are use those benefits. Right now, something that we'll be communicating, and many of you probably know, we're working in Oregon with the Cover All People, which is to cover our families over the age of 19 who, with their immigration, that may not meet the immigration status, because right now it's at 19. I'm like, well, what about, after they're 20? Like, it's something that we're still working on, and hopefully in Oregon we'll one day cover everyone.
So Leona had a question. Are they still covered if they're attending college? And then Alyssa has a question. Under Cover All Oregon, let's say they're 18 and they're in college. Are they still covered?
Yeah, it doesn't matter. As long as they meet the income criteria, they should be also covered. Then when they turn 19, let's say they turn 19 on November 1st, they're still covered throughout the end of the month for full benefits. And after that, then they will go into COWN, which is the emergency only. And just so you know too, for pregnant women, we have that benefit 3 months after their postpartum, after they delivery, they still have the 3 months of full coverage. And pretty soon, it's not to announce, well, it's not yet out, but next year we're looking into covering pregnant women a full year. So that's something exciting for us and for our families. And these are for pregnant. So I'd say, again, that's happen next year. So stay tuned for that. Oh, and I see a question from Alisa.
Hi, Monica. Hi, Jorge. I actually have a couple questions. First of all, I was wondering, I'm really happy to hear that on the 18th, you're going to have that Facebook Live event. And I'm wondering, would it be possible to schedule small meetings like within our regions where families could ask questions about the pediatric dose and the booster? We did something similar in the spring and it was really well attended, and parents really liked being able to ask Dr. Deves like every question they could possibly think of. So just wanted to know if that would be a possibility to do again. Yeah,
sure. We actually have another provider too that just joined our team. So we'll have Dr. Deves and Dr. Andrea Lara, and she will be able to, so yeah, please send us on an email and we're happy to send it to our communications team. And if, as long as, you help spread out the word, making sure families join and give us time in advance, we can always schedule something. But yeah, definitely, that's literally how families, when they have the space to ask those safe questions to a doctor, it's what, really help us to get more families vaccinated and informed. Mm-hmm.
Yeah, thank you. That's really great. And then the second question I have is a little more obscure, but I was thinking about how OHA has received a lot of funds to do a lot of like social determinants of health support for families. And of course, we all know that mental health has been one of the most heavily impacted like pieces of this pandemic. It's its own pandemic. So I was just curious, like what funding could look like for doing mental health supports for families. I know if you're doing PPE and other kinds of funding, other kinds of grants, would it be possible to do something related to mental health for our family? I know Jonathan has his fingers up, like maybe we don't have very long, so maybe that's a longer discussion to have offline. But.
Yeah, definitely, like mental health, as many of you, like is something that we're closely looking into, especially with Cover All Kids as well. It's something, just give you a little bit of a fact. Actually, when we look at the numbers of people who seek services through Cover All Kids, we noticed the number of our families was similar, like very small compared to the greater, larger population. So we don't know, right, if it has to do with a lack of maybe bilingual, bicultural providers, which could be. That's largely one of the ones that we can figure it out. But also I think mental health still kind of one of those topics that it's not as in our families talked about. Some of them are still taboo. And there's so many, right? The pandemic definitely didn't make it easier. So, but yeah, let us know. That's a topic that we're talking about a lot more, especially with the coordinated care organizations that manage the care of our OHP members. Jorge, do you have
Okay.
something to add? Sorry, I'm just kind of like.
No, I don't. I mean, I guess I would encourage everyone to reach out to our partners. We've provided their contact information. So we have a document with all of our partners where they're located, and all of our partners can help you actually navigate all of those things. I think that with the mental health issue, I mean, that is a service that's available through OHP, right? If families don't have health insurance and they need mental health services, they can get enrolled in OHP and then access those services. And those partners, they're not just doing COVID work, they're also doing OHP, a lot of them. So they're a wealth of resources that are available to you all and to the families that you work with. So I really encourage you all to reach out to them when you have time and just introduce yourself, or maybe you're already working with them, I don't know. But anyway, yeah, that's all I have to add, Monica. Thank you.
I noticed you put in the chat the link for registration. Thank you.
Yes, thanks, Jonathan. Well, thanks again, Luis. Thank you, Jonathan, for allowing us to be here today. Thank you to Monica for presenting. Thank you to all of you for being here today. Please reach out. You will have our contact information. Monica and I are here to help and serve you. Please understand that we want to collaborate. This is great. Thanks a lot. Thank you, Moni.
Thank you. Have a great day.
Yeah, thank you, Monica and Jorge. With that said, actually, we have a lunch break. So we should resume our next session at 12:30. So have a great lunch. I hope this was helpful. And see you.
Let's give an applause to our speakers, guys.
All
Good
right.
job. Thank you for your presentation.
Thanks, everyone. Take
Thank you.
care.
Uh-huh.
Bye-bye.
Bye.